Hello everyone. On behalf of the team, I would like to thank you for attending our presentation entitled Overactive Bladder Syndrome is associated with elevated urinary pro-NGF to NGF ratio in an aging female population. Here we report that the pro-NGF to NGF ratio in the urine of aging women with overactive bladder syndrome was significantly higher in association with the proteolytic enzymes that are responsible for the metabolism of NGF. Nothing to disclose. A little bit of a background. The urinary components have a prime importance on urology diagnostics to give us an idea about the pathology that's going on in the bladder. One of these components is the urinary nerve growth factor, NGF, which is commonly considered as a biomarker for overactive bladder syndrome. Recently, the pro-NGF, the precursor of NGF, was found to activate P75 receptor to induce degenerative and apoptotic processes in diseases like diabetes and metabolic distress. So the aim of this study was to identify the changes in the pro-NGF and compare that to the mature protein, the NGF, in old women with OAB, and we correlated that with the changes in the proteolytic enzymes. So briefly, the design included obtaining an ethical approval, and we recruited patients in a urology clinic. And the inclusion criteria were a female patient between 50 to 80 years with OAB symptoms or OAB diagnosis, and control subjects who were OAB free. Patients who were excluded, any patient who had well-established diabetes, kidney and liver disease, malignancy, chemotherapy, genital prolapse. All these factors interfere with the analysis of the protein in the urine. So we included 40 patients at the end, 20 control and 20 OAB subjects. And for each participant, we did a vital signs recording and full clinical evaluation. The patients were requested to complete validated symptom questionnaires, 3 of them, and complete in 24 hours voiding diary. On the morning, the patients were asked to give a blood test for electrolytes, lipid profile, and glycemic indices, and to give 2 early morning clean catch urine samples, 1 for culture to exclude also the UTI patients, and 1 to be frozen directly for analysis. The analysis was mainly done by ELISA and enzymatic kits. So the demographics of the patients included that the age was significantly higher in the OAB group, and the patients with OAB showed higher levels of insulin, which was reflected also on the HUMA IR, which is an indicator for insulin resistance, was also significantly higher in the OAB group. When we compared the components of urine, we found that the pro-NGF to NGF ratio was significantly higher in the OAB group, along with an increase in the MMP7 and MMP9. MMP7 is responsible for the cleavage of the pro-NGF to NGF, and the MMP9 is responsible for the degradation or the proteolysis of the mature form. So we thought here that by increasing the MMP7, we'll have more NGF, but when we look at the MMP9, we found that the increase was several folds more than the control, which might explain why NGF was less. In this slide, you can see the pathway of the proteolysis, where MMP7 cleaves the pro-NGF in addition to plasmin, and the mature form will be degraded by MMP9. Both of these are inhibited by TIMP1, and the digestion of the NGF results in peptides. So that's at the normal conditions, but in the subjects of OAB, in our case, we found that prostaglandin and nitric oxide, which are known to induce MMP9, were resulted in a very high level of MMP9, which might explain why NGF was less. So to conclude, we found that the pro-NGF-NGF ratio was increased in age with concomitant changes in the maturation and degradation, and this ratio was higher also in the OAB subjects as well as the proteolytic enzymes. So we believe that the ratio of pro-NGF to NGF could be constitute a more accurate biomarker for the diagnosis of OAB, though that this is very mature to say that, but more tests should be done on a wider population to conclude on that. And we also believe that the convertase inhibitors for MMP9 could constitute a new promising therapeutic target for NG, OIP.